Hello. I will now explain about life after leaving the hospital. It is time for you to start living at home. Let's get used to it little by little to make things easier. Today's theme are 1. Mom's body. 2. Your baby. 3. Breastfeeding after leaving the hospital. 4. Information on the breastfeeding outpatient clinic and childcare follow-up clinic. 5. Moms whose babies are in the NICU or GCU. The first topic we will discuss is mom's body. After a successful delivery, the body takes a little time to recover. The uterus, which has grown during pregnancy, reverts to almost its original size around the 1-month checkup. During this time, there will be a vaginal discharge. Initially red, the vaginal discharge changes from brown to yellow to white as the recovery progresses, and disappears 4 to 6 weeks later. Forced movement may cause the vaginal discharge to increase. Therefore, until the 1-month checkup when the uterus is in the recovery period, it is important to prepare an environment in which you can lie down and rest when you are tired. And provided the 1-month checkup does not reveal any problem, let's return to normal life. Also, please only shower rather than taking a bath until the 1-month checkup, and keep the area clean. I also recommend taking a foot bath to warm your body. Please also refrain from intercourse until the 1-month checkup. Family planning is the process of planning how many children to have and raise every other year, prioritizing the health of the mother, followed by age, finances, and other factors. After delivery, the inner surface of the uterus has not fully recovered. Avoid intercourse during this time due to the risk of bleeding and infection. Provided the 1-month checkup does not reveal any abnormality, you can resume it. However, for the sake of the mom's body, try to avoid pregnancy within a year of childbirth. Particularly after a cesarean section, please consult with your doctor and plan your next pregnancy. The time when menstruation resumes after childbirth varies from person to person. As ovulating before menstruation, which indicates the possibility of pregnancy. Sometimes, people become pregnant without even seeing a single menstrual period after giving birth. Of course, pregnancy is possible, even during breastfeeding. To prevent pregnancy at an unwanted time, use contraception from the first sexual intercourse after childbirth. There are several methods of birth control, some of which cannot be used immediately after birth or during breastfeeding, so please check carefully. Those who wish to do so should see their local obstetrician/gynecologist. After childbirth, you may be moved to tears or feeling sad over trivial things. Sudden emotional changes may occur. I'm anxious about leaving the hospital and taking my baby home. I wonder if I will be able to do it properly. Suddenly become anxious and can't stop crying, or start to cry over a casual comment from a family member or something that normally wouldn't make one cry. These are said to be caused by changes in hormonal balance and changes in life after childbirth. There is no strange because it can happen to anyone. Get support from your family and others around you, eat a balanced diet, and get enough sleep. It may be helpful to speak with a specialist, so we recommend that you come in sooner rather than later for a newborn visit. We encourage you to engage in postpartum exercises to help your body recover. Please refer to the Hello Babies postpartum exercises page. It is also recommended to do them while listening to your favorite music or enjoying an aroma. Daily practice has a number of positive effects, including recovery of the pelvic floor muscle group, improvement of urinary leakage and hemorrhoids, recovery from fatigue and relaxation, recovery of the uterus by promoting vaginal discharge, improvement of breast milk production by stimulating blood flow, and relief of constipation and swelling. Please try it in between childcare. The following symptoms may occur when the postpartum body does not recover smoothly. When there is a sudden increase in bleeding after leaving the hospital, e.g., when the nighttime napkin fills up quickly, or when there are clots of blood that resemble liver. If the malodor causes nausea, you should contact the hospital for a checkup. Also, when there are mastitis symptoms such as redness of the breast, formation of lumps, or fever of 38 degrees Celsius or higher even at the elbow. When there are cystitis symptoms such as pain when urinating, a feeling of residual urine and frequent urination. When there is a fever of 39 to 40 degrees Celsius or higher with pain from the lower back to the back. When nausea intensifies, you experience malodor and/or a fever of 38 degrees Celsius or higher. In these cases, there is a possibility of infection and you should contact the hospital for a checkup. The 1-month checkup for moms will be held at the Tama Medical Center. The doctor will make an appointment for the checkup time upon your discharge from the hospital, so please confirm the date and time. On the day of the checkup, you will need to bring your maternity health handbook and sanitary napkins. Please refer to the Hello Babies 1-month checkup page for details. To go through the checkup process, first put your consultation ticket through the return machine when you arrive at the hospital, and take a urine test at the one-time checkup reception desk. You will then head to the OB/GYN outpatient clinic. Both these appointments will be called by a call machine, so please wait in the waiting area. Please note that you cannot bring your children to the clinic as a general rule. I will now discuss your baby. Babies cannot communicate verbally. Observe your baby carefully during bathing, diaper changes, and feedings. Bathing is a good time to examine the naked baby's entire body. Look carefully for any signs of eczema on the skin, or soggy areas where the umbilical cord has been removed. Also, check whether the baby's hands and feet are cold or hot, and adjust the clothing and room temperature after the bath. Bathing your baby may be a little nerve-wracking until you get used to it, but it is an important time for skin-to-skin contact. After the bath, use the umbilical disinfection set provided to disinfect the area until it is dry. If the area around the navel is red, hot, and swollen, please see a doctor. When changing diapers, check for any diaper rash and the color and shape of the pee and poop. If there is diaper rash, it is best to wash it off with lukewarm water instead of rubbing it with a diaper wipe. If you have a moisturizing cream, it may be a good idea to use it. Refer to the stool color card in the Mother-Child Handbook for poop color, and see a doctor if white or gray poop is produced. When breastfeeding, the baby breathes through the nose, and the sound of breathing may be noticeable. The formula preparation method is described in Hello Baby. Each manufacturer's milk may also have its own instructions, so be sure to check them carefully and follow the correct method for preparing the formula. After using a baby bottle, you will need to sterilize it. There are 3 disinfection methods, including Milton, boiling, and microwave disinfection cases. Choose the method that best suits your family's needs. While breastfeeding, the baby breathes through the nose, so the sound of breathing may be noticeable. If you notice a runny or snotty nose, take care of it. In addition, refer to Hello Baby's How to Raise a Baby page. And remember when and what symptoms you notice. If you think something is wrong, and see a doctor as soon as possible. In case your baby has a seizure, vomits green or brown, has blood in his or her stool, has gray or white stools, or has a fever before the 1-month checkup, you should see the doctor. For the color of feces, please check the color of feces card in the Mother-Child Handbook. When you visit a doctor, please contact the Children's Medical Center or a pediatric clinic near your home. Your baby's 1-month checkup will be conducted at the Children's Medical Center. Please call the reservation center at the Children's Medical Center to make an appointment. Please make an appointment on a different date from the mom's 1-month checkup. Please refer to the Hello Baby page for details on the 1-month checkup. First, go to the general reception of the Children's Medical Center and complete the necessary procedures. You will need to bring your Mother-Child Handbook, health insurance card, diapers, diaper bag, change of clothes, and milk if necessary. Please finish breastfeeding at least 1 hour before the examination. I will now discuss breastfeeding after leaving the hospital. After delivery and frequent breastfeeding during hospitalization, the breast factory is in a state of readiness to make more and more breast milk. To get this boob factory going, it is important to stimulate it a lot, either by direct breastfeeding or by milking. It is also important to inhale firmly and deeply. Please ensure the mother can inhale deeply and firmly before leaving the hospital. Nighttime feeding is said to be particularly effective. By continuing these efforts, the boob factory will be firmly on track. The roads for carrying breast milk will be opened and the breasts will be able to make milk. The time when breasts start to appear differs from person to person, so it is important to persevere. Please also ensure mom is rested, relaxed, and eating a well-balanced diet. Taking care of yourself will help to increase the amount of milk produced and help you feel better, both physically and mentally. Breasts continue to change rapidly after discharge from the hospital. It is a good idea to find a midwifery center near your home where you can consult with a midwife who can watch your breasts. One concern among mothers is whether their babies are drinking enough breast milk. After discharge from the hospital, this question is often asked. Sometimes after the baby drinks breast milk, he or she wakes up after about 20 to 30 minutes and wants it again. I am concerned that I am not giving enough breast milk. Breast milk is easily digested, and the baby may wake up soon after drinking. Direct breastfeeding is also reassuring to the baby, and since sucking is very hard work, the baby may doze off and fall asleep while nursing and then wake up immediately and want it again, because it has not yet drunk enough. Even though there is no scale on the breast, there are some guidelines you can rely on. Signs of adequate breast milk are all that is needed. If you feed your baby breast milk as often as possible without panicking, the milk production will match the baby's needs. One of the concerns would be how to breastfeed the baby after discharge from the hospital. For moms who want to exclusively breastfeed, please see the signs your baby is getting enough breast milk, and have your baby suck on your breast as much as he or she wants and whenever he or she wants. By letting your baby suck frequently and firmly with deep suction, your breast milk production will improve. It is difficult at first, but both moms and babies will be able to continue happy breastfeeding provided the amount of breast milk produced matches the amount needed by the baby. When you leave your baby with us or when you need to rest for a while, try to give him or her milk or milk pumps at first, aiming for 50 to 60 milliliters each time after discharge from the hospital. If 60 milliliters is not enough, you can increase it by 10 milliliters each time to see how the baby is doing. However, if the baby weighs less than 2500 g, it may not go at the pace just mentioned. Be sure to get advice about future breastfeeding before leaving the hospital. For moms who want to breastfeed if possible, please see the signs your baby is getting enough breast milk, and have your baby suck on your breast as much as he or she wants and whenever he or she wants. Moms who want to do their best to breastfeed their babies should try to get them to suck on their breasts 10 to 12 times per day. By letting your baby suck frequently and firmly with deep suction, your breast milk production will improve. If you are unable to feed the baby well and directly, be sure to stimulate the breasts well with nipple massage and milking after each feeding. Continued milking improves milk production and allows the baby to be breastfed. Consult with the staff in detail before discharge as to how much milk to supplement until breastfeeding is established. We recommend that you follow up with a breastfeeding outpatient clinic or a midwifery clinic in your neighborhood after discharge from the hospital. Please contact our staff if you wish to visit our breastfeeding outpatient clinic. For moms who want to mix breast and formula milk feeding, let the baby suck on the breast first. If the baby is satisfied with the breast, there is no need to supplement milk. If the baby is not satisfied with the breast, supplemental milk should be added. The amount of milk depends on the baby's weight and how well the breasts are producing. Please discuss this with our staff before leaving the hospital. If possible, it is recommended that you follow up with our outpatient breastfeeding clinic or a midwifery clinic in your neighborhood. Please contact our staff if you wish to attend the breastfeeding outpatient clinic. As with formula feeding, mothers should adjust the volume after discharge from the hospital to 50 to 60 milliliters at a time, or 10 to 20 milliliters at a time, depending on the baby's weight and condition. By the time of the 1-month checkup, the baby will be drinking about 80 to 120 milliliters at a time. However, if your baby weighs less than 2,500 grams, you may not be able to go at the pace just mentioned. Be sure to get advice about future breastfeeding before you leave the hospital. My breasts hurt so bad. I can't get my baby to suck. If this is the case, massage the nipple and areola to make them soft and stretchy. Then nip them deeply. It is also a good idea to hold the baby in a different way than usual. It is also effective to feed the baby from the less painful breast. If you nurse with a deep nipple, the sucking may be painful at first, but it will gradually ease. If it continues to hurt, the sucking is too shallow and should be repeated. Before leaving the hospital, have your doctor check to see if you are sucking deeply enough. If direct breastfeeding is too painful, you can try milking the baby. There is a knack to hand milking, so please learn it while you are in the hospital. Mastitis is one of the most common problems during breastfeeding. If you have symptoms of mastitis, such as a lump in your breast, pain, redness in the area of the lump, or a fever of 38 degrees or higher measured at the elbow, please see a doctor as soon as possible. You can also be treated at our outpatient breastfeeding clinic until your 1-month checkup. Information on the breastfeeding outpatient clinic and childcare follow-up clinic. The hospital offers an outpatient breastfeeding clinic and childcare follow-up clinic to follow up on childcare after discharge from the hospital. At the outpatient breastfeeding clinic, midwives provide advice on childcare and breastfeeding support. Reservations are required, so please make an appointment with the staff in charge during hospitalization, or call if you need to make an appointment after discharge. Fees may be charged when treatment for mastitis or breast massage is necessary. The childcare follow-up clinic can provide consultations and childcare support by a pediatrician. The clinic is appointment only, so please let the staff in charge know your wishes and make an appointment while you are in the hospital. Childcare follow-up clinic will include a doctor's examination and prescriptions for medications when necessary, so a follow-up visit fee will be charged. Please bring your insurance card or medical card if ready. I will now discuss moms whose babies are in the NICU or GCU. Moms whose babies are in the Children's Medical Center, I know you are worried about spending time away from your babies. Thank you for your daily visits and milking. Even after mothers are discharged from the hospital, they are busy going out for visits with their babies, before the 1-month checkup and milking their babies. But please take care of yourself and try to rest when you can. We can explain how to do milking and help you with it while you are in the hospital. So please ask us anytime. If your baby is hospitalized in the NICU or GCU, the 1-month checkup will be scheduled at the Children's Medical Center, according to when your baby is discharged. Please have the record of your hospitalization in the Maternal and Child Health Handbook, filled out at the Children's Medical Center. Hearing tests and tests for inborn errors of metabolism are performed at the Children's Medical Center, and test results should also be confirmed at the Children's Medical Center. If your baby is admitted to the neonatal unit of the Tama Medical Center, and then to the Children's Medical Center, we will provide you with the results of tests performed at our hospital. This concludes our guidance about life after discharge from the hospital. Thank you for your attention. You will now begin to raise your child at home. Childcare has just begun and you are at the starting line. Long childcare is hard on your body and mind, even if you work hard alone. So please get many people to support you. Grandparents, siblings, friends, and neighbors, as well as the local health center, will help you get through this time. Thank you for your hard work.